So, okay, so what we got here is I'm in the first aid room just kind of hanging out, and Mark walks in and he says, my chest is hurting. And so I said, what happened to you? He says, well, I was at the loading dock and my assistant was off today and my angina pain flared up. When I look at him, he's looking a little bit pale. So I say, all right, let's get this fantastic cot I have. You just put your head right down on there for me. Cool. And so as he tells me that his angina pain flared up and I'm looking at him, he's a little pale, I grab my oxygen. We're going to have this talk again, aren't we, about this? So I turn this on to 10, I give that to him to breathe, I grab my gloves and I throw it on. And as I'm doing this, I'm trying to figure out ways that I can, figure out what he needs. So we count breathing. Breathing is going to be, we'll say 24 and effective. Radial pulse is present, not super, like it's not thumping a lot, it's present, maybe even on the weaker side, but it's really quite quick. And then skin is pale and maybe a little bit cool. So now I'm sitting here going, well, I don't need a rapid body because there wasn't any problems, in terms of something striking him. But I still don't know what I'm going to do. So I steal the PPQRRST as a diagnostic for a transport decision. So I say to him, all right, so how long has this pain been going on for? And he says, 5 minutes. And so I say, all right, is this pain similar to your other angina pains, which is a quality check? He says, yeah, it's about the same. I say, well, have you taken your medication? He says, yes, I've taken one. I say, well, can I see it? So I grab it, and I'm looking at the medication to make sure it's his, to make sure that all the appropriate stuff lines up. And now that he's lying down, I say, how are you feeling? Is this relieving it? Is the oxygen and the rest and the medication making you feel better? And he says, yes, I'm starting to feel better. So at this point, I grab my patient assessment chart and I start filling that out. Give me a couple things. It gives me a little bit of time to look at him and see how he's doing, as well as I now have something to reference from in a couple minutes to make sure that my return to work call is still the same. Okay? Or he dies and then we cover him and run away. Okay. Any questions? Pretty good? Okay, so let's look.